According to Mayo Clinic, a tubal ligation, also known as having your tubes tied, is a type of permanent birth control. It disrupts the movement of the eggs to the uterus for fertilization and blocks sperm from traveling up the fallopian tubes to the egg. Since it is a permanent procedure, it should only be considered if you don't want children or you're happy with the amount you have.
The surgical procedure is performed by a highly trained doctor and takes approximately 15 to 30 minutes. It is carried out under local anesthetic and sedation, using simple techniques to seal the fallopian tubes. Sterilization works by sealing the fallopian tubes that carry eggs from the ovaries to the uterus. Eggs are prevented from meeting sperm, so pregnancy cannot occur. There are several different ways of closing the fallopian tubes, including clipping or banding them shut, or cutting and stitching, or burning them closed. A laparoscopy, or mini-lap, are one way to do tubal ligation. These are done by inserting a viewing instrument and surgical tools through 2 small incisions, which is a laparoscopy, or 1 small incision in the abdomen, which is a mini-lap. These are the most popular ways to do tubal ligation. An open tubal ligation, or laparotomy, is done through a larger incision in the abdomen and is rarely ever used unless you are having open surgery for another reason. Sexual activity can start again when a woman feels comfortable, usually after a week. Women who have surgery performed through their vagina are advised not to put anything into their vagina for 2 weeks to avoid infections.
Reasons women get tubal ligation is because it lasts forever, and then if you have medical issues with birth, it will help that process. And if you don't want kids, it's a very great reason to get that as well. And then it's also a permanent solution.
The benefits of tubal ligation is you don't have to worry about other forms of birth control. There's a 99.5% chance of you not getting pregnant after you have decided you don't want children anymore. You won't have PMS because the levels of estrogen and progesterone will not be affected.
Some side effects are abnormal bleeding, bladder infection, severe cramping, and due to a damage in blood supply during surgery, you can get post-tubal ligation syndrome, which is a rapid decline of estrogen and progesterone hormone levels, and with surgery comes complications and risk.
Tubal ligation is 99.5% effective. About 1 in 200 women get pregnant later on due to incomplete closing of the fallopian tubes. If you change your mind after your tubes have been closed off, you may be able to have your tubes rejoined. However, this is only 70% successful. Tubal ligation, however, does not protect against STIs at all.